Anthropometry is the non-invasive measurements of the human body in children and adults. It is derived from the Greek word anthros, meaning human, and metron, meaning measure. The core components of anthropometry include height or length, head circumference, body circumference around the waist and hip. This is to assess for adiposity, weight, body mass index or BMI, and skin fold thickness. In this video, we will cover how to interpret growth indicators in children using the following growth charts: length or height for age, and weight for length or height, as well as key things to remember when interpreting them. Plotting on the growth charts is simple. Ensure that you are plotting on the correct growth chart as they differ for girls and boys, age groups, and each growth chart differs according to what parameter is on the X and Y axis. Age is always on the X axis, weight will always be on the Y axis, and length or height can be either. For example, here is your weight for age chart, weight for length chart, and length for age chart. Plot as precisely as possible and connect adjacent points to observe a trend over time, which we will come back to later. The length or height for age growth chart is used to identify children who are stunted due to prolonged undernutrition or repeated illnesses. The weight for age growth chart is used to assess whether a child is underweight or severely underweight, and not to classify them as obese or overweight, although it is often mistakenly used for this too. If a child has edema or fluid retention, make a note of this at the point that you have plotted, as it may be masking an underweight child and should be monitored. The weight for length or height, or the BMI for age growth chart, is used to identify children who are wasted and severely wasted. And this is often caused by a recent illness or food shortage causing this acute and severe weight loss. The wasting can be chronic as well, and BMI for age charts become useful when the age is unknown, such as with refugee children. These charts are also more helpful to identify children who are at risk of becoming overweight or obese. Before we can interpret the plots, it is important to understand what a Z-score line is, or a standard deviation is. Z-scores on the WHO growth charts show how a child's measurements, such as height or weight, compare to a reference population. A Z-score tells you how far a child's measurement is from the average or median for their age and sex, with the line labeled 0 representing this median. For normally distributed measurements like height, the Z-score shows how many standard deviations away from the median a child is, with most children falling near the middle. For non-normally distributed measurements like weight, the Z-score require more complex calculations, but the concept is similar. It helps identify how a child's weight compares to the average. The Z-score lines numbered positively 1, 2, 3, or negatively -1, -2, -3 help to interpret growth. A child whose growth is close to the 3 or -3 Z-score line may indicate a potential growth issue, although other factors like growth trends, the child's overall health, and genetics should also be considered. When a measurement is plotted, it can help to determine if there are any growth problems. Although we have already highlighted what each growth chart can tell us, the following summarizes the key points. These are your Z-scores. Note that the measurements that lie between the -2 and +2 Z-scores are considered normal. If the length or height for age lies between -2 and -3 Z-score, then the child is stunted. Those that plot below the -3 Z-score are severely stunted. When looking at weight for age, if the child plots between -2 and -3 Z-scores, the child is considered underweight. And if they plot between the -3 Z-score, they are severely underweight. When looking at weight for length, if they plot between the -2 and -3 Z-scores, they are wasted. And if they plot below the -3 Z-score, they are considered as severely wasted. If they plot between +2 and +3 Z-score, they are overweight. And if they plot above the +3 Z-score, they are considered obese. If a measurement is plotted exactly on a Z-score line, it can be considered in the less severe category. So if a child's weight for age plots on the -3 line, the child should be considered underweight and not severely underweight. Note that a single plot can help in identifying a growth problem. However, it is also important to consider all of the child's growth charts together in context, particularly if one shows a problem. For example, a stunted child with length or height for age below -2 may have a low weight for age where they are underweight, but normal weight for height. Where one measurement plot gives you a snapshot of a child's growth, interpreting a series of measurements over time or a trend is helpful to assess whether a child has been growing consistently and well, if they have a growth problem, or if they may be at risk of a problem soon. A trend is considered normal if the growth trend is parallel to the median and a Z-score, and may be above, below, or on the line. However, The following should alert you to a possible problem and requires further investigation. If a child's growth line crosses a Z-score line, if there is a sharp incline or decline in the child's growth line, or if the growth line remains flat, i.e. there is no gain in weight or height or length between 2 visits. It is important to appreciate that one needs to consider the child's overall health and circumstances when interpreting these trends. For instance, if a child has lost weight due to illness, a sharp increase on the growth chart may indicate healthy catch-up growth. Conversely, for an overweight child, a slight decline or stable weight trend towards a median can suggest a beneficial catch-down.